So let's get going. Good morning, Master Gardeners, and welcome to our February 2022 association meeting. When I say that, I can hardly believe it. It's already 2022 and it's already February, but here we are. This is our second all Zoom meeting for 2022. I'm very hopeful that for our March meeting, we'll be able to go back to our hybrid in-person for those who feel safe doing that, and Zoom for those who would prefer to not be in a big room with other people. We'll just kind of monitor the situation and keep our fingers and toes crossed that COVID situation continues to improve as it appears to be doing, and that we'll be able to be, at least some of us, in person in March. I will now turn this over to Bill, who will introduce our speakers this morning. We're very excited for this program. So Bill, take it away.
Okay. Well, it's really a pleasure this morning to introduce our speakers. Our two speakers this morning are Jessi Voltin, Doctor of Physical Therapy, and Courtney McTheny, Doctor of Physical Therapy, both with Pivot Physical Therapy here in Williamsburg. Usually we're talking about how to take care of our plants, but today we're taking a different tack. We're talking about how to take care of the gardeners so we can take care of the plants for a long time to come. If some of you haven't noticed, a lot of us aren't spring chickens anymore, and it takes some care to take care of us. And I think the very best recommendation a healthcare person can get are when people have success. And how I heard about these two was hearing from a number of master gardeners about what great success they had by going to Pivot Physical Therapy, which is the practice run by Jessi and which Courtney is part of, with physical therapy, that they had received their therapy there and had done wonders for them, had been able to do all kinds of wonderful things to keep them active and in the garden and doing all their other activities. And I just felt, as did some of the other gardeners, that this was just a wonderful topic for us to take up, to learn some things from these wonderful practitioners that could be helpful for us going forward. So I'm delighted that they agreed to take some time out of their busy clinic schedules to instruct us, to give us some pointers, to give us some lessons we can take home, and to give us some faces that we can seek care from when we need it. And so I would like to turn it over to Jessi and Courtney. I would ask that if you have questions, put them in the chat. I'm going to be watching the chat, and then I can present questions to them. And during the intermission before the business meeting, those of you that want to stick around too can probably throw a few questions to them too before they get on with their busy clinic schedule. So those are the ground rules. And so I'm delighted to introduce Jessi and Courtney. Thank you.
Thank you so much for that introduction, Bill. I loved what you said about you usually take care of the plants, but it's always a good idea to take care of the gardeners as well. I love that. I'm Jessi, and this is Courtney. Hello. Thank you so much for watching today. We're here in this very tiny room to talk to you about correct body mechanics while gardening to prevent injury and overuse. As Bill said, Courtney and I are physical therapists with Pivot Physical Therapy. We're located in the Norwich Clinic. There's a couple in Williamsburg, but we are in the Norwich Clinic on Richmond Road. We are actually going to be relocating something that I've been looking forward to for many years, to a slightly larger place. We're going to be relocating at the end of March to the Lightfoot Marketplace down by Harris Teeter. We'll be right next to Velocity Urgent Care on the end cap closest to Harris Teeter. We are an outpatient clinic that treats orthopedic conditions ranging from neck pain, back pain, to total joint replacements, spinal fusions, shoulder surgeries, balance and gait. We do all of that. I specialize in the McKenzie method, which is an evaluative and treatment process for the neck and the back. We are a smaller clinic here. There's another clinic in Williamsburg that is a little bit larger and has more therapists. We are a 3-therapist clinic, but when we relocate, we will increase to 4 therapy, the 4th physical therapist. And the therapist that will be joining us will bring on her specialty of trigger point dry needling, which I think will be a good addition to our practice. I would like to begin talking today a little bit about basic anatomy to understand how the joints work together in order to accomplish a task such as gardening. Joints most at risk for gardening include the shoulders, the back, the hips, and the knees. And other joints are involved as well because, of course, everything in the body is connected. And if one joint is being used, the other joints can overcompensate and end up increasing your risk for injury over time. I want to emphasize spinal positioning during our conversation because the spine is the core of the body. And if the back is not being used properly, then everything else will suffer. So it is important for you to note that back pain is very common, and 50 to 75% of people in their lifetime will experience back pain. Risk factors for back pain are prolonged and repetitive bending, lifting, twisting, and sitting. Courtney's going to show a picture of the spine, and sorry if you can't see this, but we're going to do our best here to let you visualize. So the spine consists of the vertebrae, which are stacked on bones that are stacked on top of each other. They go from the top of the neck all the way down to the bottom of the back. In between each of the vertebrae are the intervertebral discs. I'm not sure if you can see those, but they're squishy gelatinous substances that are in between those bones, and they help to provide, allow for shock absorption and improved mobility of the spine. Then there's the spinal cord, of course, that goes from the brain all the way down the back and is protected by those vertebral bones. Off of each level of the vertebrae are a pair of nerves that come off of the spinal cord, and the ones in the neck, those nerves innervate or make the muscles work in the arms, and the nerves coming off of the low back innervate or make work the muscles and the sensation in the legs. Thank you, Courtney. So most back pain occurs from 3 different situations. The first thing is postural insufficiency. So if you are sitting in a bad postural position or just leaned over for a long period of time, those muscles and tissues in the low back start to strain, and it can become painful over time. The second thing is arthritic changes. So the space in between those vertebrae starts to thin, and there's more wearing on the bones, and that can cause pain as well. And the last thing that can cause pain in the back, most of the time, is intervertebral disc bulging. So those squishy discs I talked about in between the vertebrae. This occurs when there's enough strain in one direction put on the spine to cause the disc to protrude out of where it's supposed to be. It can cause pressure on a nerve that comes off of the spinal cord, which can lead to a series of symptoms such as numbness, pins and needles, pain and weakness, radiating down the extremity, whether it be your arm or your leg. We call it technically radiculopathy, but it is known commonly as sciatica. So that's kind of the gist of what I wanted to talk about with the anatomy. Courtney is going to now talk about the proper body mechanics and a variety of different ways to help reduce strain and stress on the spine while gardening.
Hello, guys. Can you guys hear me when I'm in the back of the room back here?
Yes.
Yes, okay, good. So when it comes to your body mechanics, you guys are the experts at gardening. I am not. I can barely keep a plant alive. But if we don't keep you guys doing what you're doing, no one's going to make my yard look beautiful. So when it comes to your mechanics, the best thing you can do is you want to use your body in the most efficient way possible to decrease the strain or the force that you're putting through your body so you're reducing injury. When you're doing that, a lot of times you're having to lift things, whether it's a bucket, a carton of plants, a pot, anything, a potting soil, anything you're having to lift. You want to do it properly, because if not, like Jessi said earlier, lifting is something that's really, really common in terms of back injuries. When you are lifting, you want to make sure that the first thing you're doing is you're not bending over. You guys can see me right here. See this curvature in my spine? That puts the spine in a very vulnerable position. It can create bulges, you can herniate discs, you can strain muscles, not a great mechanical position. So we want to first make sure we get down your squat. So when you are squatting, most people think, my feet are kind of together, I'm just going to reach down like this. That's not a really great base of support. So you want to start with your feet a little wider than shoulder width. So if you can see me here from the side, I'm nice and wide, and here in the front, my legs are a little wider than my top. Can you guys see at least to my knees right there? You might not be able to see my feet. Yes. Yeah, okay. So when you're doing this nice wide stance, you also want to make sure that your chest and your head are up, that you're not facing down toward the ground. You're going to take your bottom or your hips and you're going to stick them back like you're reaching into a chair. If not, your knees are going to go forward and they're going to reach over top of your toes like this. Not a position we want. We want to have as much support as we can going through our whole body, not just relying on our spine. So we're going to stick our bottom back, our chest and our head are going to be up. Now, when it comes to picking something up, I don't want you reaching out really far. If you have to pick something up, ideally your elbows are going to stay between your knees. What I mean by that is as I go down, my elbows, and I'll show you here to the front too, they actually are in between my knees because I've got a wide enough base of support. Now, if I'm going to use this box, we'll just pretend this is a crate of plants, right? When I'm lifting this, I want to keep it really close to my body. So if I'm reaching out here, it's starting to strain my shoulders, starting to strain my upper back, my lower back. So when you're lifting, no matter how heavy it is, it needs to be close to your body. So I'm going to perform the squat again and show you with this in between my hands. It's a little easier when you have an object that you're keeping it nice and close. When you want to pick up an object or put it down, you don't, again, want to reach really far out from your body. You want to shift your body weight. So you're going to go from your back foot to your front foot. So I'm going back to front, getting close to where I'm going to place it, and then place the object down. I'm not reaching out here to pick this up. When I do this, I'm creating a really long lever, which puts a lot of force on my body, more so than I want. So when I go to pick up again, nice wide stance, picking it up, bringing it back. When it comes to transporting anything that you're carrying, a pot, box, anything like that, you don't want to plant your feet here and twist your body. When you do that, you're putting a lot of torque and twisting on the lower part of your pelvis and the lower part of your spine. Whenever you're working at a station or just whatever you're lifting or moving, you want to make sure that you're opening your body. So you're opening your feet and facing whatever the task is that you're doing. You're never here and turning and twisting and looking around you. Makes sense so far? Hopefully. All right, the next thing. When it comes to reaching and doing anything overhead, might not be as common, but you might be pruning, you might be hanging plants, you might be watering something that's really up high. You don't want to go straight above your head. When you do this, you're putting a lot of extension in your neck here, and the force is going straight through. You want to use as much of your whole body as you can, so you reduce the load on each individual joint. When you're doing that, you're also going to go from a bent elbow position to a straight position. You lift your arm out here like this. This is a much longer lever. It's going to be a lot more force being put on my shoulder joint. So if I come from here, it's going to be a lot easier. So from this bent elbow, you're going to be reaching up and forward. You're also not going to keep your feet planted. Like we talked about earlier, you're going to shift your body weight. So you're coming from a bent elbow, you're reaching up, and then coming back down. So a nice, good body movement using all of my body. I'm not straining in or my back. Next, when you are, say you're at a table gardening or you're at a sink, even when you're just washing dishes, some people might feel this, even if you're not using something that's up tall. when you're using a stand, say it's just slightly shorter than what you need. A lot of people to do this, right? This little bit of lean right here in your lower part of your back. You do that long enough, you're going to be really, really strained. You're going to get fatigued. Oh, it's going to be aching. You might get some pain going down the legs. So instead of this position, again, we want you in that squat, nice wide stance. You're going to squat, whatever activity you need to do for as long as you can. Come back up, take a rest break, and then repeat. Yes, this is more time cost. It's going to take you a little bit longer to get the activity done, but overall, by the end of the activity, you're going to be a lot less fatigued, a lot less strain, and not as much pain, so you'll be able to do more over time. When it comes to doing things on the ground, you guys are probably down on the ground a lot. You might not all have tables. So when you're actually on the ground, some of the best positions are what we want to go over next. So kneeling, on your hands and knees, or sitting. I'm going to use Jessi to demonstrate as a model, because when you're doing this, same mechanics apply as when you're standing. You still have to use a good position. So we have nice thick Airex foam pads we use for balance here, but a lot of times we'll put people who had joint replacements, we'll have them put their knees on this, so it's not as much force going through the body. So I know they have gardening little foam pads and stuff that you can use when you're outside. So we're on the ground here. You can see that. I'm going to move the camera down. Make sure you guys can see. Better visual there?
Yes.
Okay. So when she is on her hands and knees first. So again, as wide feet as you can get to keep yourself still on the cushion. When she's reaching to something, I don't want her reaching really far out of her grasp. You want to be within 1 arm's length distance around your body. So reaching just for what she can with 1 arm, she's not overextending her body. And if she needs to get something that's maybe way over there near her hips, she's going to rotate her whole body. Just like we talked about moving our feet and opening our body earlier, you're moving to where you're going. You're never reaching, right? You want to take your body to what you can. Makes life a little bit easier. Next, if you have to be in a kneeling position, so you're nice and upright, but your knees are still on the ground. You have to bend over to get to something on the ground. Say you're not on all hands and knees, you need both hands at one time. Instead of, again, that bending over position, Jessi's going to get into a nice squat. So she's going to stick her bottom back. Again, her chest and her head are still up here, but she's able to use both hands now. Perfect. So getting up. Getting up is one thing that makes things tough, and it keeps people from wanting to get down onto the floor all the time. So for her to get up, she's going to bring one leg, whichever one you feel most support on. You're going to bring that up into a kneeling position, and then she's going to use both hands to push through her leg to push herself up into standing, because you don't always have, when you're outside, a chair or a couch or a rail or something that you can hold on to help yourself get back up. Bring the screen back up. There we go. All right.
Okay. So another way to avoid strain on the joints while gardening is to choose tools. Tools need to be light in weight and long in length to be ideal to avoid stress in the shoulders and the back. You want to utilize soaker hoses or irrigation systems versus carrying around a big jug of water, watering can, or pulling heavy hoses. And if you need to pull a heavy hose around, try to find a long handle on the end of the hose so that you hold the heavy part of the hose towards your body and then the handle pushes out farther. This will, again, decrease the stress on the shoulders and the upper back. Try to use a wagon, a cart, or a wheelbarrow to carry items around the yard as opposed to just carrying heavy things back and forth. Try to wear good fitted gloves, believe it or not, make a difference. So something seamless that it's nicely fitted, that'll avoid and reduce friction in the hands and can prevent slipping. And then shoe wear also has a big play in everything because everything starts from the ground up, right? So you want to try to don't wear those flip-flops outside to garden. You're asking for an ankle injury. Try to wear shoes that are well fit and have a nice arch support. Make sure that they try to find some that are tied tightly and that come above your ankles so that when you're walking on those uneven surfaces that you don't accidentally roll your ankle. Courtney was talking about the clog shoes,
Yes.
gardening shoes.
So if you're in, a lot of patients like those slip-on clogs or Crocs, right? Because you can wash them off outside. Great in theory, but you don't have to. If you have Crocs, we talk about putting them in overdrive. So you're going to put your strap up on the back. If not, something that at least is a clog that has a back to it, because that way your foot doesn't have to work so hard to hold it on. One, so you're reducing your chance of plantar fasciitis issues in the future. But two, it's a little bit more stable. Your foot's not going to roll as much because you're on a lot of uneven ground pretty often.
Shoveling and raking was something we wanted to review as well. We see a lot of people out in the community that like to bend forward when they rake, and they're just constant bending all day, and you're like, oh, their back is going to hurt later. So try not to bend over, and instead what you need to do is you shift your body weight forward and backwards with the rake itself, and don't plant your feet and reach, but move with the rake or shovel. This will really help to take pressure off of the back and instead spreads it across the entire body. And her knees are, I'm going to move this down, her knees are a little bit flexed the whole time. So some of that shock absorption is being taken through the knees as opposed to the back. All right, and you want to go over gardening tasks?
Yes. So before you get started, best thing you can do, you got to get your muscles warm. So here we put you on a bike or a treadmill or an elliptical. You might not have that access. If you do, go ahead and use it before you get your day started. If not, at least just take a couple laps around whatever landscape you're going to be working on, get things warmed up. A little bit of stretching, if you know any of those stretches you've seen or you've been taught in the past, go ahead and do some of those. You don't want to take really cold muscles and then go put a lot of heavy lifting and load on top of them. That's how injury usually happens. Like Jessi said earlier, if you can use a cart or a wagon, you want to maximize the efficiency, but also reduce the strain. So keeping a lighter load and doing more trips back and forth, although again, a little more time consuming, by the end may actually save you time, because if you're hurting and you're having to take more breaks, you're also not going to be as efficient. When it comes to the planting process, like I said, you guys know what you're doing. These are just some tips to try. When it comes to like perennials or shrubs, maybe try to put those in places that are either higher up or harder to reach areas further in the back, something you don't have to tend to quite so that the things you're having to really get on the ground for a lot, you can get to much more easily. You're not having to overextend your body, really reach on your shoulders, your back, your hips, something you can access a little bit easier, goes closer to you, the things that you're going to have to change more often. Also, we had talked about tables earlier. Anytime you don't have to squat, right? You don't have to put more strain on the knees, you don't have to use your body even more, the better. So if you can use a tall stand, a gardening sink, a table, anything you have access to that brings you up to a better height, make life easier. Work smarter, not harder. So you're going to bring it to you instead of having to take yourself to whatever you're doing all of the time. Again, if you want to stand, that's a great option. We talked about earlier, if you want to be in a kneeling position, getting a cushion, they have some kneeler seats, anything you can do to reduce how much force from the hard ground or concrete, a sidewalk, anything you're on, going straight through the knee. If you like to sit, sometimes sitting on the ground, cross leg, right? That's not the best on the spine. So if you can sit, you're either on a stool, on a bucket. Again, I think you can flip some of those kneeler seats over, or you're on hands and knees using the cushion again. I believe that was all for that one. So we just kind of want to wrap up. I know this is a lot of information we're just kind of throwing at you. So if you have pen and paper and you can, we just want to kind of hit on some of the take home points for you guys to jot down. If not, we can always send these out in an email that you guys can share together and then, you know, take notes and stuff on. So the first one, number one, is we want to make sure you're avoiding bending as much as possible. No frequent bending over for the back.
The more strain, the more you bend, the more strain is put on the back. So try to avoid that bending. The second thing is make sure you squat correctly. And it's so important. We're going to review that again really quick for you. So try to keep your feet in a wide base of support. That keeps you from losing your balance. Your weight should be through your heels, not on your toes. You don't want to be up on your toes when you squat. So the weight's on your heels. You stick your rear end back. Your weight, you're shifting your hips backwards. You keep your chest up tall and you keep your knees behind your toes. So when you come straight down, you keep your hands in between your knees to avoid that reaching outward and excess stress on the shoulders. And go ahead and turn and face towards us too. So you can see this a few different ways. I see a lot of people when they squat, it's this. You got to go forward or they just bend straight down. And so it's very important to practice this at home. Keep your hips shifted backwards when you squat.
Yeah. A lot of times patients will get to here, which is great, and then they do this.
Yeah.
Right. So keep yourself going all the way down until whatever you're carrying or holding actually touches the ground.
The lifting muscles live in the hips, not in the back. So you should be feeling when you stand up after lifting something heavy, you should feel it in your rear end and those muscles, not in your spine. The spine, again, is just the core that's holding everything together.
Number 3, make sure that, again, whatever you're lifting, you are keeping it very close to your body, especially the heavier it is, the closer it needs to be to you, not reaching out, like we said, with those really long lever arms. So keep the load close.
Yes. Instead of, and on top of that, instead of reaching, you want to move close to the item. So you're not reaching out to pick up a bucket like this. You want to scoot it close to you, perform almost like a mini squat, and then lift up that item and walk.
Okay. Yeah. We talked number 4. So number 5, keep a cart, a wheelbarrow, whatever you're using to transport things, keep the load really light. More trips, lighter load.
And then the last thing, just be aware of your correct attire when gardening. That does make a huge difference. Make sure that you have well-fitting gloves and especially the shoes like we went over. They have arch support, they have a back to them, they have a nice lace, something that keeps the shoe snug on your feet, and something that might be a little taller that can go over the ankles to support and stabilize your feet when you're walking on hills or uneven surfaces.
Yeah. And to kind of add on to what Jessi's saying about what we do want you wearing, there are some things we don't want you guys wearing. We don't want you wearing back braces. I know there's probably at least a couple people out there who are strapping something on before they go to work. Yes, if you're lifting hundreds and hundreds and hundreds of pounds, right, in a facility, a warehouse, you want a little extra support while you're doing that. But when you wear that brace or you put that little binder on, right, it's taking over for your body. So when that's on, your tummy muscles, your core, abdominal, deep, low muscles that we use to help support our spine aren't activated. They're not working because something else is doing the work for them. It feels great while it's on, but you take that off and now everything just collapses in the spine. The muscles kind of start to get atrophied over time. They start to weaken, not very helpful. When it comes to your knees, a lot of people have knee pain, arthritis, or they've had a knee replacement. There's oftentimes a lot of swelling or a lot of pain there because of the swelling. When you're on your feet a long time, it's okay. We don't want hinge braces, things that are really preventing motion and creating weakness, but wearing a compression sleeve, just a nice pull-on knee sleeve, they're pretty cheap, over the counter, you can order them online, something that doesn't have a hole in it. The ones that have holes, all that fluid or swelling that you have in your knee is going to go right to that hole. So something solid that you can pull on. Only wear that while you're active. While you're up, you're gardening, you're doing a lot of things on your feet. When you come back, sit down, take it off, rest, prop the knee up, ice it. But it's something that will keep the joint compressed, keep the fluid at bay so it doesn't keep getting so swollen and you're not in so much pain, especially if you're going to be kneeling a lot.
Good additions there. I think that was it. Did you
Yeah.
have anything else? So thank you so much, Master Gardeners, for listening to us this morning. I hope we were able to provide some take-home points that you'll use in your next gardening adventure. The floor is now open for questions.
That was really excellent. In fact, you've pointed out so many areas where I'm doing everything wrong. I'm going to have to change a lot of bad habits, so I'll get to work. So hopefully you'll keep me in the garden a lot more years than I would have otherwise been able to do. So thank you. There were a couple of questions. One question Sue Carlisle put in the box was, is it better to pull a cart or push a cart? Any feelings about that?
Go ahead on that one.
So pushing is always going to be a lot less force on your body. When you're pulling, you're having to bring things to you. You tend to get into a more arched position. When you can push something away with your body, you can use the whole body. So the force is going through all of your body rather than just the spine. As I'm pushing forward, I've got a lot more power and energy expenditure than I do pulling back towards me, where I'm just pretty much using my arms and relying on my back.
I think there's a few safety risks for
Mhm.
pulling. And then if you're pulling straight backwards and you're going up or down a hill, that can be dangerous.
Mhm.
Also, I just imagine someone pulling from the side. So
Yeah.
you're not as symmetrical when you're pulling
twisted.
something behind you this way and
Yeah.
twisting your spine. So I would definitely say, keeping that good mini squat position, holding onto a wagon and pushing it is much more effective and safer, truly,
Yeah.
than pulling.
Okay, thank you. And Janet Fender asked a question about, do you have any advice on digging? Any particular advice when you're digging with a shovel, best ways to do that to avoid strain and stuff? That seems to be an activity that causes some trouble.
We were talking
Yeah.
about that.
We're like, we don't have a ground to show you guys, but
I mean, I would definitely be doing it similar to the correct squat position. You can dig using a shovel go ahead.
yeah. So you can't really see me, but you're here, right? So you're in that squat. You're not like this.
Turn sideways.
You're not leaning like this. You're in a little bit of a squat position. So your knees are bent, kind of like that ready position we talk about. You can put your foot on the shovel. That's fine to help push it into the ground. But as you go down, you're going down into a squat and lifting up. When you come up, you're not reaching out here and pulling up to you. The more times you do that, you're going to get very fatigued. Also switch your feet up. So you're pushing through, you're lifting straight up. If you're talking about big shovels, now a little like trowels and things like that when you're on the ground, pretty simple. Again, just keeping it in front of you. That's not very heavy. But yeah, big shovels, tall shovels, you're going down and then pulling up with the rest of your body.
Try to keep what you're digging right in between your
Yes.
legs, just as if you were lifting something between your legs, instead of digging a hole right in front of you or away from your body. It should be right in front of you. So you're really just doing the same thing. You're squatting. It's essentially just a good normal squat, but you might have one foot slightly in front of the other as you dig down into the ground like that.
And come back up.
I hope that helps.
Does that help?
Yeah, definitely, yes. So the principles of keeping it close and
Yep.
Yes.
doing the squats the right way, those are the
Mhm.
principles, really.
Yep.
Also, Cherie asked a question, are wagons or carts better than wheelbarrows as far as balance or stuff? Meaning a cart having wheels on each side, so it's more balanced, so you're not side to side.
Definitely for risk of falling, the cart is going to be much safer and something we would prefer. But wheelbarrows, you have them, you're using them. You just want to make sure when you go to lift it that your weight is equal on both hands, because if you're really tipped more to one side, you're going to start to feel strain there. You don't want to twist and turn it here. When you keep it straight in front of you, so when you go to turn it, your whole body is turning with it. You're not pivoting over here.
But yeah, I think that for the balance, the safety, the wagon would be better than the wheelbarrow.
Yeah.
Okay, very good. That's all of the questions that are in the chat box. I would invite people to unmute for a second and speak up if you have a question that has not been answered. Any questions that you would like to ask? If you ladies would hold on for just a minute so we see if anyone speaks up.
Yes.
Bill, it's Vicki.
Yes, Vicki Rockwell.
Yeah, can you sit and garden, what would be a good position for sitting? I mean, I don't like to kneel on my knees all the time because it hurts after a time. So I kind of sit down.
So sitting ideally not completely flat on the ground, because when you do that, right, you've got to be like this. So you tend to get in a very rounded position in your back unless you're holding yourself here. Otherwise, you're crossed here. It's a little better in terms of an upright position, but you're doing a lot of twisting here at the pelvis and the hips.
Some people don't have
And some people can't even get in that position. So ideally, if you can be, even though this is short, on a low stool here, you're not going to bend over. Let me turn to the side. You're not going to bend over like this. You're going to be in a good position, hinging at your hip. So I'm still holding that nice little arch in my spine. My tummy muscles are still contracted, but I'm working here. So ideally something off of the ground if you are going to sit.
And for her, she's so tall,
Yeah.
probably a higher level stool for her would be more appropriate. You know, if you tend to be a little bit shorter, the lower stool is fine. You just don't want to have too much, you don't want your knees too much over your hips.
Yeah.
So yes, I do think you can, I think that is fine. Just find the correct height of stool for you.
Okay, thank you.
Excuse me.
Bill,
This is
I have one question too. I'm struggling with arthritis in my first and second cervical vertebrae. Any advice on how I can keep gardening?
Yes. So gardening, it does require you to be looking down a lot. And that's the thing that you try to want to avoid when you have a lot of arthritic symptoms is excessive flexion or bending of the neck. So Courtney mentioned utilizing the tables to do a lot of your work on. I would suggest trying that to do as much as possible with your flowers and plants and a higher, possibly on a table height, countertop height, so that you can be looking down with your, holding this down, looking down with your eyes while working with your hands. So you're more like this, as opposed to having to be down, looking down at the ground doing any kind of work. It's all about the neck position when it comes to arthritic changes. You really want to try to keep your head neutral. So avoid a lot of this position.
So arthritis or even just muscle tightness, right? So anything that's going to create pain there. The position we often tend to get into is this rounded forward shoulder position. And we kind of get our head like this and we don't even notice it. And we're putting a lot of strain on the muscles here. So if you're at a tall table, wonderful. If you're at a tall table and you can sit on one of those really tall raised chairs or stools that are up high, even better, because then your hands are here at waist level. Your eyes are looking straight at what you're doing. You're not having to look up really high and you're not having to have your head down a whole lot. If you do have to be down looking, try no longer than like 5 minutes at a time. Set a timer if you have to. Yeah, take a break, move your head around in different directions. So you're not stressing that position for a really long time.
Great. Thank you.
This is Caroline Hedrick, and I do have a question. When I try to do the squats, and I'm keeping my back relatively straight, trying not to do everything you're doing, I still feel it through my knees.
Okay.
As opposed to my hips, and I can't figure out to really get down to squat really low. I put strain on my knees, and I don't know what to, I don't know what I'm doing wrong.
Yeah. The hard part about squatting, you are going to feel it in your knees, especially if you have arthritis. It's going to strain that area. You're going to feel it really pull in your quads, which is that muscle group that's right above the knee. The best thing you can do, a lot of times will have people do like a mini squat instead of a really full deep squat, because when your butt gets below 90 degrees, right? So if she goes down, if she gets to here, that's a lot of pressure on the knee.
Still need to tilt this down a little bit. Sometimes deep squatting is just not going to work. So having maybe a stool there to sit on and take some pressure off your knees might be helpful. But the mini squats would be appropriate. But when you get down really low, and it's so hard to keep your knees from going in front of your toes. That's what's going to put a lot of pressure on your knees. You got to keep the weight backwards. But it's hard to hold that position for a long time, and it's hard to repeat that over time. So I would suggest at that point, either keeping to a mini squat or trying to utilize a stool at that point to take the weight off your legs when you're having to work down lower.
But always when you're picking things up, yes, it's going to be straining on the knees, but to protect your overall spine, which you're not damaging your knees by doing it. It doesn't feel good, but you're not causing any damage by doing it.
Okay, well, that's the main thing I wanted to know.
So if you bend your spine over, you're going to damage it, right? But if you just squat at the knees, it doesn't feel good. It's straining. Try the compression sleeve again to just take a little pressure off of it. ice them at the end, because we'd rather you take the force through the leg. Yes, you're going to feel it at your knees. Your hips are doing work, your glutes are, but the stronger you can make your quads and your glutes and your hamstrings to support it, to take a little pressure off of your knees too.
And just really focus on when you squat, keep your knees from going in front of your toes.
Yes.
You want to have your knees behind your toes to keep the force off of that area.
Okay, thank you.
You're welcome.
Any other people want to chime in with questions?
Bill, I
Okay.
think there were a couple more questions in the chat.
Oh, okay. Let me see. Let's see. There is one. Drew Morgan asks, do you recommend strap-on knee pads or foam pads?
Yeah, you can use those. As long as it's not pinching in the back of your knee. I've had patients use those over the years. That's fine. Make
That
sure
would
they stay up.
allow you to be able to move around
Mhm.
without having to get up and down so often, and
Yep.
repetitive sitting to standing can wear you out. So
Yep.
staying down on your knees and being able to carefully, work on that hands and knees with the pads on. I think that's great. And it also would be easier than having to move the pad around everywhere.
Okay, very good.
Yeah,
Yeah.
I think that's great.
And
Great tool.
another question, Shadow Harmon was asking about what about dealing with carpal tunnel in a dominant hand when you're gardening? Any hints for someone dealing with that?
So the lighter the loads, the better on your hand. So that whole, like we were talking about, keeping the weight close to you, you want to be avoiding lifting heavy things with carpal tunnel. That we almost delved into the different types of tools and styles, but we thought that was a little bit too far of our
I'll be
Our
here.
wheelhouse.
area a little bit.
But
Have
you
a
want to
good
have
time.
something that's easy to move with your hands and not so much force, so that you're not having to grip so much. Carrying a handle or a water jug with a heavy handle, that's going to put a lot of strain through your finger flexors, and that's going to worsen that carpal tunnel down there. So light loads on your hands, you can carry things under your elbow and your arm as opposed to gripping things with your fingers so much when you're dealing with carpal tunnel.
And try to keep your wrist in this like neutral position as much as you can. If you're keeping it bent like this or really extended and you're putting force in these really hypermobile positions, you're going to have a lot more wear and tear over time. Whereas holding that neutral position, a little bit better there. You could do some taping, which isn't as cumbersome as a big brace. Just kind
hands
of
and knees with their hands.
Yeah,
like
so if
this.
you're on your hands and your knees, instead of being like this, see how my hands are and my wrists are really being strained here? You can come up onto your fists if you have to, moving around like this. So it's a lot less stress on the wrist joint. Something else I didn't tell you. What were you saying about that just now?
The types of
Oh,
handles.
yes. So when you're using, don't remember the names, you guys can correct me. There's an anvil and there's another name. But basically, when you're using blades, you don't want blades that come straight down on top of each other unless you have to. That's for bigger chopping and like branches and things like that. But you're putting a lot more force through their body when you're doing that than if you have blades kind of like scissors that are coming past each other. It's a lot easier, especially when you're like snipping little plants and things. It's a lot less force going through the grip of your hand.
And one more question that came up, Wilma Sharp is asking, she mentioned she has had double knee replacements, had a lot of therapy, had Pilates, but knees still hurt at times. Is this normal? And she does a lot of gardening still. Is this something she's just going to have to put up with in her situation?
Depends on what's causing the pain. So a lot of times there's a lot of inflammation still, because once they replace the joint, there's no longer arthritis there, right? You've got artificial parts that are rubbing, but there can still be a lot of inflammation. And anytime you are after knee replacement, one of the things we tell you to try to avoid if you can is a lot of kneeling.
Mm-hmm.
So sitting for those people, standing for those people, squatting is better, because if you are doing direct kneeling, that's direct
That's a
pressure
lot of
up through
pressure.
the knee. So if the knee is a big area, not going to be ideal.
Repetitive squatting, repetitive
lot.
squat is gonna also probably irritate.
Yeah.
So maybe split up your day with gardening. Don't do so much at one time. Take a break,
Yeah.
come inside, ice your knee for 10 minutes.
Yeah.
Even though it's been a while, you might still want to ice, and then go back out later. Do small bits at a time will take the pressure off your
Yeah.
knees as well.
And try the compression sleeves.
Yeah.
just keep those on while you're out, see if it decreases your overall pain over time.
And of course, the advice goes without saying, if it keeps on going, you may want to get back and see your orthopedic surgeon and then possibly get in and see you
Yeah.
guys professionally, individually. So
Yeah.
Absolutely.
Yep.
that's always a good recommendation. So, well, just want to thank you, ladies. You guys are true professionals who know a lot more about gardening than we do about physical therapy. So thank you so much. You've been wonderful.
You're
And,
welcome.
Yeah, no problem.
Thank you so much for having us.
We really appreciate your expertise, and I'm sure many of us will see you in the future. So thank you so much.
You're very welcome.
Yes, thank you. Thank you, Jessi and Courtney. We do appreciate your taking the time out of your busy day. So we will, as Bill said, let you get back to your patients, who I'm sure are champing at the bit to get back to working with you. And we will take a 10-minute break.